right, so I think we'll go ahead and get started. I want to welcome everyone to the Inclusive Excellence Council. And it was so interesting because, as we all know, time is just so strange these days, or the last 2 years anyway, it just seems kind of warped. So I was remembering, and Allie reminded me that our last meeting had actually been in November. So it's been a while. And, we talked about this coming year, having our Inclusive Excellence Council meetings an hour and a half and meeting every 2 months instead of every month, so that people could get some of the work done in the committee work and just have that time to do that. And so we're excited that this is basically our new year, but my God, we're almost to April, but our first of 2022 Inclusive Excellence Council meetings. So thank you again for everyone for being here today. And we have a great agenda, so I'm going to go ahead and get us started here. We'll go into our land acknowledgement next, and Helen Villarreal-Nielsen will share this with us. Thank you, Helen.
Thank you, Dr. Romero-Leggett. The land acknowledgement. Founded in 1889, the University of New Mexico sits on the traditional homelands of the Pueblo of Sandia. The original peoples of New Mexico, Pueblo, Navajo, and Apache, since time immemorial, have deep connections to the land and have made significant contributions to the broader community statewide. We honor the land itself and those who remain stewards of this land throughout the generations, and also acknowledge our committed relationship to the indigenous peoples. We gratefully recognize our history. We encourage you to add your pronouns to your name in Zoom and promote that in our meetings. Thank you so much.
Thank you very much, Helen. I really appreciate that. And I like just kind of stopping a minute and grounding ourselves and just respecting the space that we're in. So a really beautiful way for us to begin our meetings. Thank you for that. So the next part, and Allie has dropped the agenda into the chat so people can see that. So again, also our acknowledgements and announcements. So we do have a new member to our IEC committee and group here. Our team, Dr. Leanne Chavez, is our new faculty at large representative. Unfortunately, Dr. Barbosa, who we thank her for her service here, both on the council, but to our communities, as she has left UNM. But Dr. Chavez, again, our new faculty at large representative, she is a Department of Surgery, board certified in general surgery and vascular surgery, a graduate of our UNM School of Medicine. So welcome, Dr. Chavez. And I don't know, I'm trying to see everyone. Let me see, I'm not sure if she's here. I was going to ask her to say a few words. I don't see her on right now, but if she would like to say a few words when she is able to join us, we'll have her do that. But yay, we're very excited to have Dr. Chavez with us here. Thank you very much. And then I'd like to also offer this opportunity as well for anyone. I know Dr. Sanchez, you wanted to share, I know about Heritage Month, but then it is open, please, to our community and people here who would like to share any announcements and updates or shout outs.
Great seeing everyone. As mentioned, we are still in Women's History Month. We had a very successful set of workshops and presentations. I want to thank everyone who helped with the planning, especially to our facilitators and speakers, including Dr. Pilar Ortega, who is nationally recognized for leading standardized medical Spanish, as well as Dr. Buick from Maine campus, who spoke about the history and the implications of monuments across the state, but also across this country. As many of you know, our next month will be Asian Pacific American Heritage Month in May. And on the HOC Celebration website, you could see what we did last year. We want to have another successful month of May, and I encourage you to submit your ideas and join the planning committee that's being organized by medical student Flora. You can, I'll put my email address in case you want to connect. And we're looking forward to getting your help.
Thank you, Dr. Sanchez. Appreciate that. And again, you can find this on the website. You can go back and view these videos that are absolutely amazing and just really powerful, wonderful sessions. So thank you very much. And for those who've been involved in being part of our Heritage Month celebrations across the Health Sciences Center. Okay, so please, if the floor is open here for other announcements, shout outs, information that you'd like to share, and especially our at-large representatives and executive officers who are here with us. And we have our other leadership here as well. Thank you.
Dr. Romero-Leggett, I'll mention that UNM delegation took part in the National Association for Diversity Officers in Higher Education national conference last week in San Diego, the hybrid platform. So there were 400 individuals in San Diego and 600 that joined virtually. And we were part of the UNM delegation that took part in the NATAHE National Conference.
Thank you, Dr. Roybal, for sharing that and for being part of that amazing conference, very impactful conference that occurs every year with the NATAHE, and for representing our university, I know with several of our other members with you there. Thank you for that. And I think, Diana, you just shared something in the chat. Would you like to tell us about that as well?
Sure. Sorry, I was unmuting. I am also putting the flyer in the chat, but we are excited to announce the Leo and OPW upcoming speaker series for 2022. We're focusing on challenges within medical and research education, and invite leaders at all levels to come and participate with us. Dr. Joanna Fair is kicking off our first session and really looking at how to create fair and equitable remediation processes and practices. And so we look forward to seeing you all there.
Thank you for sharing, Diana. And those are monthly, did you say?
Correct. They are the first Monday of every month from 12 to noon. They start, let's see, April through, I believe, October.
Okay, wonderful. Thank you. Excited to see those and learn some more as well. Thank you very much.
Dr. Romero-Leggett,
other announcements?
I have an announcement. So many of you know this already. The hospital received the Human Rights Campaign's Health Equality Index again for the 9th time. So since 2013, we've consistently received that award. We got it again this year, so we're really happy. This year, Presbyterian also got the designation, and so did Christus St. Vincent in Santa Fe. So for them, they were the first. It was their first time getting the award. We were still the first in the state, but it's nice because it means that patients all over New Mexico are getting that quality of care in other institutions. So proud of that. And thank you to Cameron Crandall for helping support that process every year.
Thank you. And Fabian, would you just share a little bit more or just tell us about that award just a little bit more?
Oh, sure.
Again, congratulations.
Thank you. Yeah, so the award goes to institutions that have policies in place for employees and for patients. So for things like an employee who wants to get, who needs a gender affirming surgery, we cover that through our benefits. It also has to do with training and community engagement. So we're kind of scored in those 4 categories. And to get the designation, you have to receive 100 points out of 100 possible points. So, the next step is for us to become, there's like another level, a higher tier of getting that leadership. So my goal now is to make sure that we get that next. We're the first in New Mexico to get that designation. But yeah, it's something that we should all be proud of, because the institution takes care of queer employees and also queer patients. And we have a lot of things in place to make sure that we continue to do that.
That's excellent. Again, thank you so very much. And Dr. Roybal, I believe you and Dr. Pandey, would you please share what you dropped into the chat as well?
I can go. So I just put in the chat, the CTSC is hosting our annual Health Experiences Research training for the network. This is a way of gathering diverse, inclusive patient stories, particularly amplifying those voices that are less heard. So we would welcome anyone's participation or getting the word out among faculty and other learners that would be interested to coming this May.
Thank you. And Dr. Pandey, that is now in May, did you say?
Yes, that's correct. May 16 to 18, and it's going to be done virtually this year. And we do have international attendees and attendees already around the country. So it should be an exciting meeting.
Okay, and anyone can join? People can join that? Okay.
Yeah, people can
Wonderful.
join, and there's tuition remission option for people for registration.
Oh, great. Okay, thank you. Thank you for that. And then I believe, Dr. Revolt, you mentioned something about our IEC right now, where I think you are.
Yes, I'm over at Tamaya Resort at the moment. We are hosting the 2022 Association of Hispanic Serving Institutions Best Practices Conference. It's the 14th annual convening, and the very first conference was held at Central New Mexico Community College 14 years ago. And so we're honored to host the gathering of 400 delegates yesterday through Wednesday. And then Dr. Romero Leggett and other UNM officials will be part of the Hispanic Association of Colleges and Universities Capital Forum next week. It will be held virtually. It's generally held in Washington, D.C. And we will join our other higher education partners from across New Mexico on April 5th and 6th.
Thank you, Dr. Revolt. We have about another minute or two here for any other announcements, shout outs, anything people would like to share. I know Melissa and Ingrid, there's been a lot going on through HISLIC, really some wonderful diversity related. Is there anything more recent going on with that? And then Dr. Smart with the book club.
Oh, thank you, Dr. Romero Leggett. Yes, we are working on planning a few more things in the spring. We don't have the speakers quite nailed down yet, or the titles of the topics, but please look to our events page for new events that'll be coming up. We do have some good things planned, but like I said, we don't exactly have the titles and the names yet. So please look at that page. That thanks to Melissa for putting there in the chat, and you can put that, make sure you have that bookmarked in your web browser so you can check on that and see what we're up to. Thank you.
Thanks so much, Ingrid and Melissa. Really appreciate it, and a lot of really wonderful sessions, and just a lot happening in HISLIC. So we love seeing that. And like you said, to bookmark, I forget to do that. So thank you for reminding us there. All right, Dr. Smart, I think with the book club, do you want to just give us an update there?
Yes, we are still having a book club. It's a Community Connection and Reflection book club across the HSC. We have about 77 people who are following along and probably doing more of the reflecting. Every month there is an opportunity for the third week of every month to participate at a 1 hour slot. We usually have about 7 to 15 people who chime in for those that are happening by Zoom at this moment. We have a nice collaboration with HISLIC where the books are available, and there is a special place there available to look for the books at HISLIC when you walk in. The April book is The Scalpel and the Silver Bear, about the first Navajo surgeon. So if you are able to read and reflect, that's perfect. But a lot of times we are enjoying the community of this. We have folks from nursing, HISLIC, pharmacy, population health, and School of Medicine. It's faculty, it's staff. We've had some learners come, and you do not have to have finished the book to participate in the community building. So please do come if you are interested. The link to sign up is on our webpage as well. And we've got an endorsement.
Thank you so much, Dr. Smart.
No problem.
Oh, I'm sorry. What did you just say?
No, we've got an endorsement for the book from Angela.
Woo! All right, Angela. And On the website, what's really wonderful is if you go, you can see some of the books that, I mean, just, oh my gosh, the incredible books. Of course, ones I keep saying I want to read, so I just got to get to the book club. But you can go there, and again, there may be some that, you know, on your book list, and you can go by the library, and we have those there available for you as well. So it's a really incredible, powerful list so far. Thank you. Okay, I think if there's one last one, great, and otherwise we're going to segue into Dr. Zydonis. And I'm just checking, I'm not going, trying to go between the chat and looking at the screen for hands. So I think we're good. Dr. Zydonis, we're going to turn it over to you and welcome you to IEC, and are really looking forward to hearing what you have to update us on in terms of our strategic planning. Thank you.
Great. So I have some slides that I can share, but before I do, I just want to, while I can see faces, say thank you all. This is such an important council for all of us and the health and health sciences system, and also influencing all of UNM and our community in New Mexico. So I'm really excited to be here to learn. I was asked to talk about a few things, which I will. So I'm going to share. Okay. All right. First, again, lots of gratitude to all of you. I look forward to seeing today and in other methods in the future in writing and dialogue how each of your units are going. As you know, anybody who I work with closely as we set up goals for them, one of the goals that they are putting together is in the DEI area. And so I assume they're working closely with you to both achieve those goals, but get ideas from it. At a number of different meetings in the past, I've talked about how, in addition to the individual goals of the system leaders, that I'd like to create an accountability process, since that's been what a lot of people have asked for. How do we make some of that transparent? So today's really just introducing and writing. It always seems more concrete when it's in a writing versus in dialogue. And also I was asked to make a few comments about strategic planning, both through the UNM 2040, what's occurred, as well as the opportunities coming up in health and health sciences. So from the point of view of a DEI accountability process, I'd like to have a formal review of DEI for each unit. Dr. Romero-Leggett and I are looking at fall, early winter to have this initial effort. So again, there's lots of flexibility for input from all of you as well as the system leaders. Things that I've been thinking about, and as Val and I talk, we're in agreement on it, and I'll just outline a few of those. So some way to summarize how each unit, so a unit might be the School of Medicine, it might be the Cancer Center, it might be the group practice. How have they been doing as it relates to faculty recruitment and retention? You know, so some kind of numbers. There may be other ways to talk about it. There may be ways qualitatively to talk about a faculty equity advisor that was brought in to help in searches. I mean, there's so many ways that that could be thought about. Climate. Climate data could be the very sophisticated approach that Dr. Romero-Leggett is going to be launching soon, as well as there's other data you might have collected. Some of it might be in a engagement alignment survey. It might be through other formats. So again, we eventually will come up with something more standard. How are we on equity, whether it's salaries or promotions or leadership or whatever ways people think about that, as well as staff recruitment, retention, and then something on student data. Again, if you don't have students in your unit, then that wouldn't make sense. But for most of us will have students in the different units. So you may have some other ideas, plus those are big terms versus the specificity of what we would track. The next thing I'm interested in is with each unit, and of course, for all of the leaders here, what are your goals coming up for this year in the work that you're doing? The next is, how might we do this as a self-study? We might create a template, and you might be able to engage others with your unit leader in how would we gather information. Because I think whenever you're doing a self-study, it becomes important and people are collecting information. I would like to give awards for best practices and big impact as a result of the review. Again, it's an idea, whether it's $5,000 or $100,000, I'm open to thinking in big terms as well as little terms. And I do think just collecting our best practices would be good. So that we could all see them in some manner. And it might be in different areas. I'd also like to create a dashboard in this area. When I meet with all the clinical leaders, they have a very nice dashboard on all the clinical quality measures, on all the other measures. And so, it might not be as complex and complicated as the many measures there, but what might be a good dashboard in this space? Now, all of you have connections all over the country. So you may have ideas from many different places. I've done what I've proposed at UCSD, but I don't want it to be that way. I want it to be our way. And so I'm not going to over influence on that part, but know that I know this can happen. It is a culture change to do it, but it can happen and make a difference. So I'm going to move to strategic planning, but before I do, I'm going to take a small pause here and see if there are any questions as it might relate to the last slide, because there was a lot in there.
Do we have a copy of that?
Well, one, it's on a recording, and two, I'm happy to give the whole slide deck. When I'm done, I'll put it in the chat.
Thank you.
I have a question, Dr. Ziodonis. This is Angela
Sure.
Wandinger-Ness, and it relates to, we're going to be doing a whole institution climate survey, and I think you mentioned how do these items that you just listed for us align, either precede or antecede the climate survey, and how will it be rolled out roughly?
Yeah, well, some of what I'm doing is more data, and it's data driven. I assume that the big climate survey will have data and qualitative. It has a model and an approach. So that's going to take it to a very sophisticated level. But if we weren't doing that, we would still be able to answer most of the questions there, including if you've done the Press-Ganey surveys, you would have climate data. And there's other ways that we would do it. It would not be in the sophisticated way we're going to do it, but this is just a baseline. I just want to make sure that we have numbers as well as the qualitative climate experience and those. So Val and I have talked about your really excellent question. So we don't want it to alter that process, but there is information that we can track right away. There are best practices that are occurring in different ways. So this just aligns us together, and the other project we want still to happen.
And I think as thank you, Dr. Zaidonis. I think as Dr. Sanchez noted in the chat as well, this does also, elevate DEI in that same way as our other mission areas, and ensuring it's comparable. And we have, again, those dashboards, those best practices that we're sharing, and that we have begun doing, here and there. But again, it brings it all together. And I think in that way as well, Angela, to your question, Dr. Wandinger-Ness.
Because we have a really good point, because we have lots of initiatives going on in the clinical system, but we still have to track where we are. And so it's really trying to just secure a baseline. Again, this is just in a way to create more visibility, more importance, and to be recognized by everybody that we really want to make some differences here. But thanks for the great trigger question. And as Angela said, Press-Ganey only captures physician input, But my point is somehow each unit thinks about climate, I hope. And there may be some way that they assess it. Like Prescaney also does a staff survey, which is all staff. And there may be, so I think in some ways each unit thinks about climate. And some will just say, we have no climate survey at all. But, if you're a leader in a zone, you're trying to understand your climate in some way. The collective work that you're doing, I think, will really help us a lot. So this is really the creativity of the unit leader and you who are in the unit to think of, how do we look at climate? And the answer might be, we don't. Okay, that's baseline. All right, we'll do better. All right, I'm going to go now to strategic planning. Can you see okay with this?
Yes.
All right. Oh, sorry. Okay, so we just finished the UNM 2040. There'll be a nice brochure that comes out. Hopefully you all know about the process. There have been many opportunities, including crowdsourcing with IdeaScale, which is more of an open sharing. Then there were surveys where everybody could anonymously put in feedback, as well as many focus groups and different work groups and the overall committee. So your ideas on, as we move into health sciences and health, doing a strategic planning process will be great to help inform that. The 5 key goal areas that were identified in UNM 2040 were: 1, advance New Mexico. A lot of that had economic development. That's where the health system activities were put in, as well as working with state, county, city, and different community groups in this space. The second was student experience and enhancing educational innovation. The third and a whole goal area was inclusive excellence. Some of you served on the work groups and committees that informed that process, and that was identified as one of the big 5. Sustainability includes finances, it includes people, recruitment, retention, wellness, a variety of areas that what will help us sustain. And then the 5th area was, as one university working together, we are likely to be stronger than us individually. And I think the same could be true within health and health sciences of working together is going to help all the work we do. So a couple things. This has been for the past year our health science and health system priority areas. Health equity and community needs. You're going to have Lisa Kakari-Stone. Dr. Kakari-Stone has done awesome. She's been a great leader in the Health Equity Summit. I'm looking forward to that. You all are part of the Inclusive Excellence with IEC and SINA, and we are having early discussions of creating a center for Hispanic and Latino health. Healthy aging across the lifespan is just, again, reflective of our public health, clinical health, community health orientation for all ages. Access and high quality clinical care. Behavioral health is any meeting I go to, that's an important one for this state. We're having early discussions of creating a center of excellence in addiction. Public health, continuum with our clinical system, as well as the new funds we just received to expand our College of Population Health into a school. Expand our research and education infrastructure. A lot of talk is around data science, IT, biostats, but there are many areas. Recruit and retain faculty, students, and staff, so that one of it's been salary increases. We're going to have a 7% on average salary increase that will help us in many areas. The faculty equity advisors, we're just early on and expanding that as an option, and each unit will have some choice points of if they get involved in that model. And we're doing some excellent work in the childcare RFP that we may have even secured a building recently, like yesterday, that we're in early discussions on. So we're looking at late May to start our own strategic planning, and you all will be somehow involved with that. Diversity, inclusion, and excellence has been both a value and a critical in all our mission areas, and is one of our core 5, along with the traditional ones. I'm not going to speak to this since Lisa will, but I just want to acknowledge they're doing a great job. And for some people, health equity means individual and community, social determinants of health, ACEs, multi-generational trauma. For some other people, it means enhancing the patient experience. And so both of those will be part of the story. And the community listening tour begins April 5th in the Las Cruces area, and I'm looking forward to being part of that. From the health system perspective, we're on a down slide on COVID, which is good. Let's see how it keeps going. Our crisis standard of care expired on 3/11. Patient experience, workforce engagement, alignment, wellness, diversity, equity, inclusion, all those are important. Systemness, we continue to do that, including having more expansions outside of Albuquerque and Sandoval County. Integrating our missions, not just the School of Medicine, but the other colleges too. We have about $750 million of projects going on right now. Varies by the site and location, but it'll be in the slide deck that Dr. Levi asked, and we'll make sure it's in the you'll be able to see it. We've also created a key academic strategic initiative for the school and the 3 colleges, and some on an integrated way. I just wanted to make a mention of the School of Public Health, since I also see a lot of that being about health equity and an opportunity for you all to provide some input on this important new evolution. We've committed to the state these 6 deliverables, which again, you'll have in your packet. I didn't want to have this be an hour-long meeting, but more students, more faculty, more research dollars, a public health education network, statewide community health assessments, and 2 public health initiatives, one in diabetes, obesity, and the other in addiction. So I'm going to stop sharing there, and I'll put that in the chat so you can have it.
Thank you, Dr. Sidonis, and we'll share that as well. And I know time-wise, we probably have time for one question, if there's one right now, one burning question. But we really thank you, because it's important to really get that big picture view and see these priorities and understand the upcoming strategic planning as well. So appreciate your sharing that. But is there a question, one question that somebody has right now that we can address?
Thank you all, and I'm sure there are many, but we'll do it in another forum. But this way, you at least kind of got an update on those areas.
Thank you so much. Very much appreciated. So our next agenda item is sharing about the Health Equity Summit, and Dr. Kakari Stone and Gina Urias Sandoval leading those efforts for us with an amazing team and group of people, and of course our leadership as well included there. And the whole, this Health Equity Summit, is really bringing together and convening a lot of our diverse stakeholders from across the state, our community partners, because we really want to learn together and foster collaborations and really create a strategic framework that is going to tackle the systems and social determinants that really impact the outcomes for all of us here in New Mexico and our communities. So Dr. Kakari Stone and Gina, I'm going to turn it over to you, and thank you.
You're muted, Lisa. Good afternoon. I'm very excited about everything I've heard today, and I just want to thank everybody for their leadership and vision. especially as we speak about the Health Equity Summit. It was Dr. Ziodonis who back in July said, let's have a summit. And then the phenomenal Gina Urias has jumped in, and of course, Emily Morelli. I call us the 3 Bs. We're buzzing around. Let me give you a quick overview of what's happening, and I'm just going to share screen here. I will take a minute to do a shout out to, as we talk about diversity, equity, and inclusion, we have a National Research Center of Excellence, our Transdisciplinary Research Equity and Engagement Center. We're into a bridge year starting July 1st. And I share this because I want to invite each of you to participate in some way in the visioning and the development of our renewal. It'll be our 3rd generation center at UNM. We have 3 major goals. That's to do intervention research, to prepare early stage investigators to conduct intervention research with their communities, and to build teams and translate our knowledge for practice and policy. I want to just mention also our Weave Center, our Weave initiative. This is with Dr. Nina Wallerstein and Dr. Chelsea Parker. I want to acknowledge Dr. Pandy, who's on this call, who's a key investigator with us. But I think this is a great example of inclusion and belonging as we think about vaccine equity and the social ecology of our communities in terms of social vulnerabilities and resiliencies. And we'll be happy to share our findings at any time soon, but we are working statewide. These are our partners, and we do have a quarterly community practice network. This is all rooted in equity as we think forward in terms of our upcoming summit. We started an internal working group at the Health Science Center. And I'm going to pause because I want Gina to give some context because she's been a key leader in terms of launching this. But we spent about 3 months, and Dr. Romero Leggett, Fabian, Dr. Lawrence Rabal, Millie Ledworth, and several of you on the call have been part of this working group. So I thank you for your thought leadership. We came up with a definition that is around fair and just resources so that all can be equitable and live well. But we also embraced a racial justice approach to this. We're calling this for now as a placeholder, partnerships and actions as we think about pathways forward as we come out of a different stage of COVID and people are finding, what is it who's missing in our community? We've lost many elders, knowledge keepers, wisdom holders, and family members. So these conversations will be critical. And we want to have a goal, and please chime in, Dr. Ziodonis, in terms of your vision. But we want to reignite excitement, action, and collaboration statewide. So while we're mobilizing internally, we're having multiple conversations and meetings with key stakeholders, including Dr. Parajon with the Department of Health, Conama Health Foundation, New Mexico Public Health Association, and the list keeps growing. There's 4 major actionable items: energize, engage, produce action items as the result of the summit coming up in September. And internally, we want to build a trustworthy organization, even more so. And I think the DE&I efforts each are doing really help build that in a concrete way. So just moving forward, the summit will take place September 19th and 20th. So please save the date at the Sandia Resort and Casino. And we want intersectoral partners, including the IHS system, government officials, and many more in the private and nonprofit sectors. So it's not just UNM. I'm going to pause here because I think I want to give Gina a moment to talk about the resources and what she's doing with the foundation to assure we support community travel stipends and other initiatives she's doing.
Thank you, Lisa. First of all, I'd like to congratulate all of the pre-planning and planning committee members. Many of you are on this call now, like Fabian, who's here, Dr. Romero Leggett, those of you who have been, Millie, I think, has dropped in as well. And so I think that, collectively, we've been able to put our heads together to really think through this health summit, thinking through that it's not just UNM Health Sciences or health systems sponsored event, but that it's a community event. So what was really critical for us in the planning stages was being able to early on reach out to our partners, right? So Lisa mentioned the New Mexico Public Health Association, Con Alma, but critically the state, at the state level, talking with Laura Parajon and finding out about their plans for doing the exact same thing and how we could just come together and do this together in partnership. So I think that was a really important piece. It was an important piece of us thinking through how we wanted to reach the communities, what we wanted to present. And I know, Lisa, I'm a little premature here, jumping the gun probably to your next slide, which is talking about the place-based visits, which I think are really critical too. And it's an important piece of what we've been working towards the last few months, is thinking through going to the communities, having place-based visits that would inform the Health Equity Summit. So that was an important piece. Funding is always something that we think about when we think about events like this, and making it as relevant and as as comprehensive as we can. Really thinking through how can we do this with partners. One of our partners recently has been the UNM Foundation. So meeting with their foundation and community group fundraisers to think through how do we ask our community to help contribute to this conversation and to the summit. And so that is going really well. I think internally we have lots of support from the deans, the Cancer Center, Project ECHO have all made commitments to helping support this initiative. So I think all the way around, everyone's done a really great job, and I give a lot of credit to the pre-planning committee, but of course, all of the credit belongs to Lisa Kakari Stone for all of her hard work and really thinking through this and planning and getting this together for us. So she's the brainchild, and I'm just one of the followers. Thanks.
Thank you, Gina. And it takes a team. And I think that's what's this project has been very exciting, the enthusiasm. These are the place-based conversations. We didn't want to plan for communities, but with them. So I want to just highlight right here now, we're at the step 3 of the summit planning. Again, you're all invited, save the date for the September 19th. We're going to have an evening reception and Ignite for Equity talks. But we want to have the place-based conversations really inform the statewide planning to build the agenda and the process for the summit. And as you can see, it's not an dead-end street here. It's a goal to continue on in terms of a call to action. And I can imagine that Dr. Ziodonis and then President Stokes and others might look at this document that we'll produce and have it be a part of strategic planning priorities. Department of Health and other stakeholders are also looking to use it as a document for strategic planning and action. I'm inviting each of you to these conversations. If you have partners, please email Gina and I a list so we can invite them. It's critical we have a cross sector of those in the healthcare system, leaders, nonprofit, philanthropy, government officials, as well as frontline advocates and health leaders. So I'm still looking for invitations, and it's open. I also want to invite any one of you to co-facilitate with us. I want to highlight the equity agenda for the conversations is from the state of the art of what's happening in the equity movement. So we'll be asking, what is health equity? How do we achieve it? With a big focus on best practices. This is our way to assess solutions and what's happening around the state so we can bring to the summit. There will be a report for each of these site visits. And then Alex Sanchez and the communications team, as we speak, are developing a webpage that Gina facilitated. And that will be online with each of these reports. And then finally, I've created an equity toolkit. If you choose to be a facilitator, I have developed a facilitator's guide for everyone to leave with New Mexico as an infrastructure capacity building on leading health equity conversations. So each site host has this toolkit. We're probably going to meet bi-weekly moving forward because so much is happening. And then we'll also have an evaluation of this. So there's been a lot, and I just want to thank everybody for the vision. And it's open to questions, or if you have ideas, please post in the chat. I'll defer to Dr. Romero Liggett. I don't know if we have time.
We certainly thank you so much, Dr. Kakari Stone and Gina Urias Sandoval and Emily Morelli and the many people who have been part of this process, and Dr. Zaidonis for your vision on this and our leadership in supporting this and being active members. We do have time probably for one or two questions here. And also, Dr. Kakari, let me ask you, if people are interested or they want to be a facilitator, see the toolkit, sign up, are they emailing you all, or is there a place, a landing space that they can go to and look at some of this?
There'll be the webpage where they could see all the everything around the summit, the vision, the goals, as well as the summary reports. If you want to co-facilitate or suggest to participants, please email me and we'll add that to the list.
Great, thank you. Questions or comments, please? Lots of very nice comments and some things. And Dr. Wandinger-Ness, you're giving some ideas for people to invite as well, and some nice appreciation in the chat.
So just add a quick comment. One, lots of kudos to Lisa, your leadership's terrific. I also appreciate how you've engaged with the health system and really been a all health and health sciences initiative. You reached out to Kate, you reached out to Jamie and others to make sure that their perspectives were included. So I want to thank you for that. But this, I mean, what an impressive presentation. I've seen the materials. You only see little lines on a slide, but I would encourage you, if you're interested in this space, to reach out to Lisa and become a facilitator. You know, who knows? We might do some in other places closer to here, just and that might be a place where you could really be helpful to Lisa, since it's a heavy lift, and I just want to express my gratitude to you.
Thank you for the opportunity.
Any more question or comment at this time? Thank you so much, Dr. Kakari Stone and Gina and Emily and Dr. Zaidonis. This is really going to be critically important for us. I feel like it's a game changer for us here at the Health Sciences Center as well, and in how we can do more meaningful work with our communities. We already, there's a lot that happens, but thank you for this. Very exciting, looking forward to it. And again, the first meeting is already next week, right? Next Wednesday in Las Cruces. Yeah, so good.
Well, yeah, and there are a couple of people who are in the room. I know, Fabian, you've been doing a great job helping this group, and it's really quite a great team. So I don't know who else is on this call that's been involved, but thanks to them also.
Yes, thank you very much for all involved, and the ones who are going to be involved here in the future moving forward, because I think there's a lot of excitement and people wanting to be involved here. I'm going to real quickly, Millie, do you want to just mention real briefly something that I'm sorry I had missed in the chat earlier that actually is a beautiful segue here too, because of the community involvement and engagement piece that you shared.
The hospital is really, into the inclusion of our patients with disabilities, because it means that we're giving them physical, social, and financial access to the same opportunities as individuals without disabilities, and often through the use of accommodation. So they frequently have extensive experience navigating healthcare settings. So we wanted to hear from them. So we are in preparation of our next community health needs assessment for 2023. So the community forum for the deaf, the hard of hearing and deaf community will be April 9th at the Dominici Center. So everyone that has, family or friends or deaf community are invited. We are excited to have and to host this group, to hear, their opinions and include them in the hospital strategic planning for, for access to community with disabilities. So if you have any questions, I will put my email in the chat. So welcome to come.
Thank you so much. And I think the flyer's in there as well. So thank you, Millie, for sharing that and this really important work and things that are upcoming. So that was important for us to hear. So now we'll go into our committee reports. And I believe we're starting with our Workforce Development Committee led by Dr. Smart and Dr. Singh.
All right. I think I am vying for the shortest report out of the subcommittees today. And Dr. Singh wasn't able to be here at this meeting. So our goal for the next week is to land on what we will decide is our definition for workforce, and using that in order to figure out what the rest of our tasks will be. We have grappled with, of course, we have a HSC definition of workforce. It's in our policy of policies, but what we are hoping to do is really make sure we're encapsulating the full nature of what workforce development could be across all of the mission areas and across all of the faculty, staff, and potentially learners that we have who are all part of our workforce or workforce to be. So it's proving to be a little bit harder than we thought it would be, but we're close. And then we will be able to move forward with our next task, which would be to identify what we currently have within our system to address workforce development for those individuals defined in our definition of workforce, and then see where the gaps are and figure out what we need to do to fill them. And that is it. That is our report out, but I do recognize that we have some other individuals who are part of our workforce group, and if they would like to share, we continue to be a very asynchronous meeting model in that we are navigating doing our work by teams and limiting ourselves to maybe 3 annual meetings that might be a longer chunk of time, are action oriented and goal focused, but utilizing teams to help us stay connected and get the work done. All right.
Well, thank you very much, Dr. Smart and Dr. Singh and the committee for your work. And those defining is really important, right? And moving forward. So appreciate that. And the asynchronous meetings, those are, we want to get as much input as we can and appreciate that. So thank you for your, any questions or comments before we go to our next committee report? Okay, onward with community engagement and Dr. Flegg and Javier Rios.
Hi, everybody. I'm off camera today because my internet is a little bit slow, but this is our update for the time being. So we did send out a survey, and we have our monthly meeting scheduled for the 3rd Friday of the month starting April 15th. And I believe that's from 9 to 9:30 in the morning. So we did that, and we have met since then, but we wanted to create a more like routine time for folks to meet. And it's actually from 9:30 to 10 a.m. And then committee members currently alternate in our meetings. We have folks alternating, sharing their internal UNM and external community engagement efforts. And then during our last meeting, we discussed potentially designing a smart sheet link to capture UNM-wide engagement efforts and include them in a calendar feature. So this is like our dream for the future. It has not happened yet, but we thought that would probably be the best way to go about this. And also when we're requesting information from folks, it's an easy fill if you can click on a smart sheet link and then add it, and then we could hopefully populate a calendar with the data that it's submitted. And then we did have discussion about internal versus external engagement, and how it's valued and measured by UNM. Like, should it be a part of people's PEPs in the future? Talking about the goals that we set annually. Should community engagement be an official part across UNM of everybody's performance evaluation plans? And then I did include two small images of running medicine's efforts. So I participated in the last event, which was their opening ceremony this past Saturday. And if folks are interested, So this is spearheaded by Dr. Flagg, and to me it was excellent. It was at the open space off Montgomery for Los Poblanos, I believe it's called, the Los Poblanos open space. And it really is an excellent way to get involved in the larger community. It's very family oriented, intergenerational, and it's from walking to running to, just being in community and with a wellness focus. And so they do have a spring calendar that they have events on Saturdays, Tuesdays, Thursdays, and also on Mondays. So if folks are interested, they can reach out to myself or Dr. Flagg for just follow up. And they also have a wellness Fit Fun Fridays that's actually on campus. So it's a little easier to attend if you're interested in not having to do it on outside of your regular work schedule. But those are our updates for now, and thank you.
Javier, thank you on behalf of you and Dr. Flagg and the Community Engagement Committee, and really appreciate, again, as you all spent a lot of time looking to define and now creating ways like the Smart Sheet link and ways that it's easier for people to, as you start developing this clearinghouse of information and data in this repository. So thank you so much, and for sharing about the running medicine and what an amazing community, intergenerational. I mean, you just go and you feel that sense of community there, because you see little kids and grandmas and grandpas and all sorts of, everybody's there, and dogs. I haven't seen cats yet, but I see the dogs there, and just really wonderful. I know that several of you have been at many of these. So an incredible sense of community there. And like you said, you can walk, you can jog, you can run, but everybody's, encouraging each other the whole way. And it's this beautiful, beautiful sense of you get uplifted and of community. Are there any questions or comments?
I'll just add that I know that several of us from the UNM community were there. So if you feel like you're going to be alone, you wouldn't be. Dr. Zaidonis was there. Also, Millie was there. I believe I was there. And I met other people from UNM that I hadn't met. So if you love being outdoors, and it doesn't need to be every Saturday or every week, that they host, but it's a great way to be involved and just move yourself and welcome in the spring.
Yeah, I just want to echo, it was fabulous. It was really a fabulous event, and it was great to see everybody you just mentioned. And there are at least 10 others who came up to me and talked about something about the health system or health sciences. And so there was great attendance, but you could easily hide in the crowd if you want to hide, and you could easily be visible. So it was super.
Thank you very much. And again, Community Engagement Committee. So our academic development and professional training, led by Ingrid Hendricks, Dr. Magaf-Madueña, and Daniel Hayek.
Thank you, and good afternoon, everybody. Our group was talking about, we have some really fantastic conversations. I really appreciate that about our group. Very open, talk about a lot of different equity issues. And I always learn a lot from everybody in the group. It's really a great community. And we talked about in our last meeting, we set up our meetings just recently. We were having a little trouble figuring out times that everybody could meet this year, but we finally settled on one. And in our last meeting, we talked about developing an assessment and looking at what barriers and opportunities there are related to education. And I think one of the things that we discussed that came out loud and clear was how emotional a lot of this work can be, and how it can be very stressful for instructors. Talking about DEI topics, integrating that into their curriculum. And so we're looking at opportunities for supporting educators and ways that we can identify support structures for them. Another aspect that Dr. Wandiger-Ness brought up was development with researchers and junior researchers, postdocs, making sure that that population is not left out of the conversation, because they cross all the different units, all the different colleges and programs. And historically, that's been a group that's been kind of left out of the conversation. So we want to make a focus on that group and look for opportunities there as well. Another thing that I went ahead and created a space in the digital repository that we have, which is an open access repository. And the link is there. You can go in there right now. We don't have anything in there, but I would encourage people who have syllabi, have resources, any kind of content. We'd like to make this a space that people can share information. So as we well know, a lot of the different programs and colleges are kind of siloed to a certain extent. And so there are great things going on in all the different programs, but people may not necessarily be aware of what other people are doing. So we're hoping to create a space where people can share what they're doing. People will be aware of what's going on, and they can talk to one another and say, oh, I saw your syllabi in here, and I'd like to use parts of that, or would you mind me sharing this, etc. It is open access, so we would request that people not put things in there that are, proprietary or have copyright on them. But if you're willing to share your own intellectual property there, I think it would be a great space for people to have information and be aware of what's going on in terms of education in other departments. And I'd like to have a shameless plug for the Health Sciences Library and Informatics Center. This is outside of the committee, but I wanted to let everybody know, if you weren't aware, we have developed a wellness room for our learners, and it's not a study room. It's supposed to be a place where students can go to just relax, do things other than study, meditate, pray, reflect, and it's become very popular space. So those of you who have learners who are struggling and just need to get away, we've put this space in the library for them to do that. And please let people know that that's available for them there. So I open this up to anybody else on the committee if there's anything else they want to add to this. And if not, I can turn it over to Clement.
Thank you so much. Really appreciate that excellent report as well, and the work of the committee, and the idea about the barriers and opportunities. And I think that was a really critical conversation when you're talking about the DEI work and the educators, and how that's a little different. If we're okay, well, I'm going to go give my talk on the Krebs cycle or cardiovascular, whatever, and then when you go into the DEI and you're doing some of these different kind of work, and you go in there, like, you don't know what's going to come at you. You don't know what it's going to open up for people. It is very, can be very emotionally exhausting work a lot of times. And how do we support that? I think was just an excellent conversation, and something we'll look forward to hearing more about and looking at working towards. And then again, repositories, right? And spaces to share our curricular content. It's wonderful. So thank you. And then Dr. Wandy-Gurness, I don't know if you want to say a few words, but I know you were very eloquent in your discussion about our junior researchers and postdocs. But thank you for the work of this committee, and we're looking forward to learning more as we go forward. Angela, if there's nothing there from you here, I'm going to go forward with the Culture and Climate Committee, but if at any point, please, if you'd like to share anything more. So Culture and Climate, led by Dr. Salazar and Dr. Crandall, turn it over to you all.
So good afternoon, everyone. I would like to Ali, can you go ahead and advance the slide one? So the climate and culture group has not been meeting per se, but that doesn't mean that we haven't been actually quite busy. Since our last meeting in November, we put out an RFP to identify a vendor to help us do a comprehensive climate assessment. We went through that process and ultimately selecting a vendor, Rankin and Associates, for whom we're going to be working with. And I'm excited to say that we're going to start this process actually in July 1st of 2022. And so a lot of planning has gone into this and a lot more will be coming ahead. So if we go to the next slide. The overall kind of general timeline, I think folks would like to know how this sort of will work out and what are the various major steps and phases of this process. I do want to make a comment to Dr. Zidonis's data effort. I think that the information that this DEI equity data will be really important and complementary really to this process. They're going to be, it's a different notion in sense one will be data, this will be more around attitudes and beliefs and practices around the DEI space. So they're going to be 5 phases. We're actually going to start off with basic planning, and Rankin Associates will be conducting a number of focus groups on campus. And so we'll be looking for input into identifying various constituencies or issues for which a focus group might be important. We'll complete that in the early fall. And as we move into the winter period, we'll enter phase 2. And Rankin Associates, as well as the group working on the project, will work on developing contextualized assessment tools. Again, we're not really calling this a survey because it's much more than just a survey. It's going to be a comprehensive assessment. There will be a marketing and communication plan. And the way that Rankin Associates really works this is this will be done technically as a research project. And so we will apply for an IRB application to collect these data and to really proceed through a rigorous process. In the spring, we'll actually do the what you might think of as the climate survey portion, and we'll conduct that in the spring of 2023. And the Rankin Associates will work on the data analysis and will provide us with reports back, and for which we will then work on sharing and interpreting the findings in the summer. And finally, as we move to the end of the project in the fall and the winter of 2023, we'll be having a facilitated actions planning process really to use the information and to develop kind of ideas to move forward to address some of the issues that might be brought out by the assessment process. Next slide. You may be wondering how folks can become involved. There's really 2 major areas for which we'll be looking for help. Number 1 will be the Climate Assessment Working Group, and this will be made up of the DEI executive officers as well as the IEC at-large members, and our 4 committee co-chairs groups will participate in this process. We'll also be looking for a much wider input from what we're calling a response panel, really to sort of reflect on and to provide insight or critique of the various processes and tools that as we develop them, really looking for a broad audience to help us make sure that we're remaining on task and that all of the areas are important. I think that is our last slide. So I want to ask Dr. Salazar if I forgot anything.
Nope, that was a great summary.
Well, thank you both for your leadership there. And again, we were very excited about our vendor with Rankin and Associates to be working with them. As we've mentioned before, we felt this was a very inclusive process. We liked the fact that we're not just handed a survey and assessment that is used for everybody, that this is really individualized to our HSC, right? And I think it's going to be really important for people to be part of the focus groups and the response panels to get that input that really makes this information most relevant to us as a community. So we're really excited about it. We will be here in the next month or so, we'll be getting some more information out and dates and things that you guys can start putting on your calendar, because we know that that's, obviously one of the most important things is making sure people have enough of a heads up to get these important focus groups meeting on their calendars. Are there, and thank you again to the committee, any questions or comments about this upcoming climate assessment? Okay, so moving on into our historical report, and we're very excited. I mean, lots of great work done and information. I mean, oh my gosh. I have been here a long time, but just learning about, again, where we've been and how we've gotten there and the highlights and the investment and the time of all of you in pulling this information together, and to thank Dr. Sanchez as well for his leadership. But we've been very excited working together to move this forward and have our report out here in the next couple months. We'll be meeting with the marketing soon, so we can put that together in our document, both online and hard copy. Dr. Sanchez.
Great. I just want to make sure, can you hear me okay? Yes. Okay.
Yes.
I'm just going to pull up my Word document so I can share. Let me just switch over. It doesn't seem like it's going to work here. It doesn't seem to allow me to share my screen.
Can you send that to Allie then, just to do a
as
little
I'm
workaround?
trying to get.
Try now. It may have
I want to
been
thank everyone
resolved.
again for this. I think this has
Oh,
been
there
a
we
product
go.
that we've
There
been
we go.
talking about, in part because as we come together as 10 entities across HSC, but also on behalf of the state, it was important to understand the unique journeys in terms of diversity, equity, inclusion that each of our entities have undertaken. As you all know, each entity has had its own timeline, and each entity represents a different school of thought around diversity, equity, inclusion, whether it's the research, the hospitals, or graduate programs. So over the past couple of months, you have all been contributing to providing a snapshot of the DEI journey undertaken by your entity. As you know, some of you have existed for over 50 years. So capturing all of the great work by your entity in one document could have taken years. So once again, this report is the first attempt to highlight some of the great achievements around DEI. What I'm going to just share with you is how it's looking so far, because cumulatively, what you've submitted has been 40 to 50 pages. So I've been in the process of trying to summarize those 40 to 50 pages, and you continue to send me great information. Similar to most reports, it's going to start with just an opening thank you and what the report is about. And then the table of contents right now exists of a 9-page executive summary that I'll give you a quick glimpse of. It will then include each of your narratives. So using that pre-templated worksheet that you filled out, we will include all of the information that you've provided. And so the executive report will be 9 pages, but with what you've provided, that will be an additional 40 to 50 pages of great information. We'll be providing a summary of the development and the activities of the Office for DEI of HSC since 2008, listing all of the contributors' names, your contact information, and most recently, we added a section on glossary of terms. So each of you and your entities and your disciplines have put out a list of key terms in the DEI world that you believe is important for your members to be aware of. And it's fascinating looking at these lists and how you all define and describe them. So I've learned a great deal from looking at the different glossary of terms. So just a quick snapshot of what the executive summary will start looking like that's been outlined in these 9 pages. Thinking about the first question that was posed to you on that template, what is a brief description of the inception and history of your entity and the other 10 entities? And with the help of communications like Dr. Romero-Leggett mentioned, what you're seeing right now is a lot of text, but we're going to make this a lot easier to read, and we're going to have a lot more images and graphs and line charts. But just very quickly, just reading the first couple of sentences, since 1945, with the development of the UNM College of Pharmacy as the university's first health professional college, the Health Sciences Center has grown to consist of 10 entities. The New Mexico Nurses Call to remedy the inadequate supply of registered nurses to meet the healthcare needs of the state's increasing population led to the formation of the UNM College of Nursing in 1955. In 1961, the UNM School of Medicine was founded and has supported not only MD-seeking learners, but has also evolved certificate to master's degree programs across 7 paramedical health professions programs. So I just wanted to share that because I think it gives you a little bit of an appreciation of how we've been trying to weave your narratives together to summarize one journey, one HSC journey. So I'm really just going to stop there, but this document will now be shared with communications or media marketing so that we can format it differently, add photos that you've sent. You've already sent the photos, but now we got to put those in appropriately and make it more readable and more attractive. If anyone wants to see this, I'm more than willing to share it. And if you want to continue to contribute, just send information my way. Now, I think just wanted to see if anyone has any questions or suggestions or thoughts.
Thank you, Dr. Sanchez. And again, you said extreme gratitude to everybody for reaching back and talking to people, getting a lot of this history here, and the photos are amazing as well. So if you have other photos too that you want to share, please go ahead and continue to send those in here. But yes, comments, questions. Okay. I think we're good here, and hopefully we're not all going into that little postprandial little sleeping mode. So let's see if we have right now. I believe we're at the close of our of the presentations piece here, but I did want to open this for any discussion, comments, questions, things that might have come to you throughout the time we've had together, and then to remind people that our next meeting will be May 31st. And between now and then, we'll probably have a communication or two out in regards to the upcoming climate assessment. But the floor is open for people.
Must be the lunch. This group's normally so engaged.
I know, and we've been on a little bit of time. So this is the first time we're doing an hour and a half. And we will be ending a little bit early here, which is nice. Y'all get a couple minutes extra here, but again, really, truly appreciate, like, this is, again, this is an inaugural council. We're coming together for the first time. We have lots of things that we're defining, bringing us together. But oh my gosh, I really appreciate as we share and hear about things across the health sciences and systems. So I really appreciate all of you today and our presenters. We have several things in the chat. We'll have lots of links that we'll share as well so that people can reach out if there were certain areas that were of interest. And just to please encourage people to join a committee that might just kind of speak to you and something that you're really interested in. And to please encourage our other community members, both again within the HSC and external to HSC, to please join Inclusive Excellence Council, because the more voices, I think the more impactful and the more relevant that we will be to our missions. So saying that, I'm leaving 1 more minute. I'm going to be quiet here, just see if there's anything else anyone wants to say. Dr. Zidonis, any of our deans who are here with us, anything you'd like to share before we end for the day?
Just a lot of gratitude for everybody's hard work, and there is an opportunity for you all to make a difference also in the strategic planning process. So any strategic thinking you do as an entity will be appreciated. And there will be lots of opportunities to express the different opinions and ideas for that process. So I just want to make sure your voices are heard, and also your ideas on how to make sure everyone feels like they had an opportunity.
Thank you, Dr. Zidonis. And thank you to everybody and for being here and joining us and getting our 2022 IEC off to start here. And we will see you all coming up. Oh my gosh, May just sounds so far away, but we'll be communicating in the meantime. And just again, thank you for everything that you do. Take care.